And a very good morning to you. Welcome back. It is Rhema, Brekky, and of course it is that time of the month. Our very special monthly guest, Dr. Clara is in with us from Life Medical Centre over there at Erina. And today, big topic as well, Clara. This is about skin cancer, and it is super common here in Australia.
Yep.
More than what we want. That is for sure. So let's jump in this morning. Firstly, what is skin cancer?
So skin cancer occurs when skin cells are damaged. So for example, overexposure to UV radiation from the sun is probably the most common cause. And here are a few facts, to get us going about skin cancer in Australia. So every year in Australia, skin cancers account for around 80% of all newly diagnosed cancers. 80%. So
Wow.
That's like super common. The majority of skin cancers are caused by exposure to the sun. And our incidence of skin cancer is one of the highest in the world, 2 to 3 times the rate of Canada, US, and the UK.
Yeah, so look, I guess going on those stats there, I mean, how prevalent really is it in Australia?
So yeah, as I just mentioned, Australia has one of the highest rates of skin cancer in the world. About 2 out of 3 Australians will be diagnosed with some form of skin cancer before the age of 70. So there's only 2 of us in the room.
Right.
Chances are one of us is going to get it.
Yep.
And yeah, non-melanoma skin cancers is the most common cancer diagnosis in Australia. So, which is what we're going to cover today. And over 1 million treatments are given each year in Australia for these non-melanoma skin cancers. So there's 2 main types which we'll go into. But for a start, basal cell carcinomas can develop in young people, but it's more common in people over the age of 40. And then you've got the other type, which is squamous cell carcinomas, and they mostly happen in people over the age of 50.
Sure. So who's sort of most likely to be affected?
Well, anyone of any age can develop a skin cancer, but obviously it becomes more common as you get older because of exposure to the sun and exposure to other things. So now there are a number of risk factors that can increase your risk of skin cancer. So, the list is long, but let's go through some of them because chances are listeners can resonate with some of these. So having pale or freckled skin, especially if it burns easily and doesn't tan. Having red hair or fair hair and light-coloured eyes, so blue or green eyes, probably because there's just not as much of that protective melanin and colouring to buffer the skin. Unprotected exposure to UV radiation. So in particular, a pattern of short, intense periods of sun exposure and sunburn, such as like on weekends and holidays. Actively having tanned or sunbaked or using solarium. So, you'll notice that most of them are pretty much banned in Australia now. Working outdoors or spending a lot of time outside. So people who golf, people who garden a lot. This is an interesting one. Previous exposure to arsenic. So arsenic is a poison, as we all know. And yeah, doing a bit of research around it, there's just a propensity to increase skin cancer just on the basis of how it affects the immune system.
Right.
Which brings me on to the next point, which is a weakened immune system. So this can be from having leukemia, lymphoma, using a medication that suppresses your immune system for some other reason, having lots of moles of irregular shapes or uneven colours. So that can be a hereditary thing that happens to some people. A previous skin cancer or even a family history of skin cancer can increase your risk. And then there are certain skin conditions such as sunspots because they show that you've had actually a lot of sun damage, from exposure. And then finally, as with many other things, cigarette smoking. Smoking's been linked to a possible increase in skin cancer risk. So if you need another reason to quit smoking, there it is. And then people with black, brown, olive skin color often have more protection against UV radiation because their skin produces more melanin, which is that pigmentation, than people with fair skin. But having said that, they can still develop skin cancer too.
Yep, absolutely. Now, what are some of the common signs and symptoms that we should be looking for?
The main signs to look for are any crusty or non-healing sores. So, if you find yourself picking at something, my patients complain about that. I've been picking at this for a long time, just doesn't heal.
Yep.
Any small lumps that are red or pale or pearly, which can be a sign of a BCC. and any new spots or freckles or any moles that change in color, thickness or shape over a period of weeks to months. So rapid change. Now, the sooner skin cancer is identified and treated, the better your chance of avoiding surgery, or in the case of a serious melanoma or another skin cancer, potential disfigurement or even death. So, become familiar with the look of your skin, particularly any of the spots and moles that you've got, so that you can pick up any change that might pop up.
Yeah, sure. Now, what are the main types of skin cancer? Because there are more than one.
Yeah. So as I've mentioned already, I've bounced a few names around. Mm-hmm. So there are three main types of skin cancer that we see that are the most common. So basal cell carcinoma, also known as BCC, squamous cell carcinoma, also known as SCC, or melanoma, which is the most dangerous form of skin cancer. So now basal cell carcinoma and squamous cell carcinomas are what we call non-melanoma skin cancers. And so that's what we're going to keep talking about pretty much most of the rest of this conversation.
Sure.
And these type of skin cancers are more common in men, with almost double the incidence compared to women. But then there are also other rare types of skin cancers, including Merkel cell carcinoma and angiosarcoma, and they're treated quite differently. We're not going to talk about them just because they happen quite rarely.
Yep, absolutely. Yeah. We are joined by our resident medico, Dr. Clara Chu. This morning we'll take a quick break and we'll be right back after this. Welcome back. We are joined here in the studios by our special monthly guest, Dr. Clara Chu from Life Medical Centre. And today, big topic, as I mentioned at the start of this morning's talk, we are looking at skin cancer. But before we sort of go any further into that, we have to mention melanoma. So can you briefly touch on that this morning, please, Clara?
Yeah, sure. So melanoma is a type of skin cancer that develops in the skin cells called melanocytes, and they are specialized skin cells that produce the protective skin darkening pigment called melanin. Mm-hmm. And they usually occur on the parts of the body that have been overexposed to the sun. Now, rare melanomas can occur inside the eye or in parts of the body that generally don't get exposure to the sun, such as like the palms of the hands, the soles of the feet, or even under the nails.
Wow.
So, those things can happen, and it's important to kind of, check those parts of the body. Now, it's estimated that more than 18,000 people were diagnosed with melanoma in 2023, and the average age at diagnosis is 65 years old. So it's the third most commonly diagnosed cancer in Australia, and it's estimated that 1 in 17 people will be diagnosed by the time they're 85. Mm-hmm. Now, the Melanoma Institute Australia has developed an online tool that anyone can use to help predict what their risk is of developing a primary melanoma in the next 10 years and also over their lifetime. So I would recommend that our listeners check it out at www.melanoma-risk.org.au so that they can just assess their risk and make some informed decisions about getting a skin check.
Yep, because that is the one that we hear most about, really, isn't in the media and the news and everything else. So
yeah, absolutely.
Again, it can be fatal if it's not caught in time, I guess, too. So now let's get back to the non-melanoma skin cancers. So how are they diagnosed?
Yeah, so we generally diagnose non-melanoma skin cancers with a biopsy, which is where we remove a small sample of tissue for an examination under a microscope at a pathology lab. So especially trained doctors do that.
Sure.
So they've been trained to look at things under the slide, look at cells and all of those things. And if the lesion is small enough or bothersome enough to the patient, sometimes we may opt to remove the whole thing without a biopsy. And then, the biopsy will give us information about whether you do or don't have a skin cancer.
Yeah, now if you go through this process and all of a sudden you've discovered, I have I've got a diagnosis here, what are the next steps that you should take?
Yeah, so if you have been diagnosed with a BCC or an SCC, then we tend to encourage further surgery to remove a safety margin of normal skin around the site of the primary lesion. So that's generally there to make sure that it's been removed completely. Now, if this is the case, further treatment might not be required because if we get a clear margin,
sure.
Then the doctor might be quite happy with all that. Now, in some cases, though, your GP might refer you to a specialist, so a dermatologist or a surgeon, for an examination to look for any other skin cancers or to check that the skin cancer hasn't actually spread to other parts of the body.
Yeah, good thing to do. Now, what treatments are available if you do happen to have this positive diagnosis?
Yeah. So the first thing that usually happens is that we remove the skin cancer,
Yep.
right? Obviously sometimes things are in tricky locations, so
Sure.
maybe a bit difficult to remove, but ideally we get rid of it. So this may be through surgery or sometimes even without surgery, because if something is small, we can use other modalities to try and get rid of it.
Sure.
So, for example, some non-surgical therapies include cryotherapy, which is the liquid nitrogen that you might have had done at a doctor's surgery. There's curettage, which is basically like scraping it off. There's electrocautery, which is burning it. So one is freezing, the other's burning. You can do either. There is also photodynamic therapy, which is using a photosensitizing agent and a laser light. So obviously these are getting to be things that are a little bit more subspecialized. And then there are creams on the market now. They've been available for probably about 20 years that can actually help improve remove the BCC or the SCC.
Yep.
Now, then depending on the size of the skin cancer and whether it's spread to other parts of the body, we may then offer additional treatment. So radiation therapy may benefit some patients with certain types of BCC or SCC, especially if surgery is not suitable.
Sure.
Or if it's not the first time that they've had it and they seem to have lots of them. And sometimes even chemotherapy may be used for cases where it's spread to other parts of the body.
Yeah, sure. Now, obviously, this is it's a pretty big journey that people undertake, again, the positive diagnosis and some of the different treatments available. So what type of support is available for people with skin cancer?
Well, the Cancer Council does wonderful work with advocacy and education around all things to do with cancer. So they would be one port of call, checking out their website and, getting more information. And other would be the Australia Skin Cancer Foundation. So they also do very similar work, but obviously specifically around skin cancers. And then, of course, your regular GP and your local dermatologist are always here as well to guide you and help you answer any questions and, refer you on to the right people.
Yep. So again, if you see anything kind of out of the ordinary or something that's popped up there, been there for several years, maybe even long term, you're thinking, that was never there before, but it's kind of been around for a while, always get it checked out.
Yeah, absolutely.
That is the best advice. So get along to your GP and look, if you haven't had a skin check and you are over 40 at least, it's probably a very, very good thing to do, particularly here in Australia. Here on the Central Coast, we love our outdoors.
Yeah.
So getting all that sun exposure can cause some problems down the track. So we want to make sure we keep right on top of that. Dr. Clara, as always, thank you so much for joining us. This is Rhema Brekky. We'll be back right after this.